Roberts.
Hi, how are you?
Good, thank
Is
you.
it Mary Beth?
Yeah, you can call me Mary Beth. Our last name's Thomas, but please call me Mary Beth. Don't call me
Okay,
Miss
hi
Thomas.
Mary Beth.
Yeah.
So, tell me what brought you in today?
Yes, thank you for seeing us. Alexandra's in the waiting room, or she likes to call it Alex. I know
Yeah,
that you want
Alex.
to see us separately first and talk to me. Yeah, so I just have some concerns, about my daughter, and it's been, honestly, over most of her childhood and adolescence, and I thought things would get better as she got older, but it actually feels like things have gotten a lot worse. Um, and she's just so lovely, and she's a very smart kid, and she's so nice to her brother Tristan, who's actually her twin brother. Oh, I'm sorry, he's a year older. They're Irish twins. They're a year apart.
Oh,
Yeah.
okay, that explains it.
But yeah, she's still 17. She's gonna be 18 in a month. But she's just always been a very anxious kid. Like really, just such an angel, but super anxious. And I noticed it from like, even preschool. It would be like we would have to sit upstairs at the Y, and she would only last like half an hour before the school would be calling us to pick her up.
Mm-hmm.
Like she wouldn't be able to like stay there throughout the day.
Mm-hmm.
And it kind of got like a little better, I guess, in elementary school. I think maybe she was just involved in more activities, and that kind of kept her busy. And then in high school, it started to get worse again. She hasn't been in school for 2 weeks now, and she actually needs to know to go back. And I'd be lying if I didn't tell you that that's part of the reason why we're here, is because it's really impacting her school. And she's a senior, she's about to graduate, and they told us that she isn't going to be able to graduate if she keeps doing this, because she's called out, of school and not been able to attend for probably like a quarter of to a third maybe of the year.
Oh, wow.
Mm-hmm. Yeah.
Oh, I'm so sorry to hear this.
Yeah, thank you.
So, oh my gosh. So, I'm just gonna ask you. So, you may see me writing
Yeah.
stuff here, please. I'm not trying to take away my.
Oh, no worries. I
But it's just
understand.
to help me, to guide me, to help me answer the
Absolutely.
questions.
Thank you. Yes.
Okay. So, you said that Alexandra is her name, but she prefers to be called Alex.
Mm-hmm.
What are her pronouns?
They, theirs.
And her date of birth?
Their date of birth. I'm sorry, I was messing up her pronouns before. Their date of birth is August 25th, 2005. So he's turning 18 next month.
Is Alex seeing anyone?
What do you mean by that? Like a therapist?
Yeah,
or?
relationship stuff.
Oh, she dated somebody like last year when she was a junior, but she hasn't been seeing anybody this year. I think like she's felt pretty socially isolated, and she does have some very close friends, and they do call like almost weekly, but she really hasn't been able to spend time with people in months, so she's not seeing anybody right now. No.
And you said that you noticed that it started pretty much in preschool.
Yeah, I would say, around preschool. Like, I'm trying to think back to when she was a baby, and I feel like she wasn't like the anxious attachment, the classic anxious attachment that you see. I don't think she was really like that. Her birth, she was a preemie, so she was in the NICU for 2 months. But otherwise, like, no complications. She was, she was a little delayed with some of her milestones, and I think that has to do with being premature. But she got caught up after a certain point. But I think like, I sometimes wonder if that might have played into some of her anxiety, because she, wasn't really able to tie her shoes when everybody else was, or like she wasn't fully potty trained by the time everybody else was. But when she was probably like, in elementary school, she was, on the same
Pretty much.
level.
Okay.
Yeah.
Okay.
It was more so, I think there was just a larger gap in developmental stuff when she was much, baby
But she
toddler.
wasn't. evaluated at that time?
She never had early intervention. There weren't concerns about autism. You know, I've wondered that in the past, but we do have a family history of some family members with autism spectrum disorder on both sides. She has a cousin on her dad's side and actually a cousin on my side as well. They're both boys. But for Alexandria, you know, it's not really a... I feel is very, when she's not anxious, she's very social and vivacious and just like very like vibrant, you know. So
Really?
I don't know if it's
Okay.
I you know, for a while I was wondering if that could be related, but I don't really see that. She doesn't seem to have social deficits when the anxiety and the panic attacks aren't there. She's very much present. She's very much curious and interested in others and you know, interacts with others appropriately and all that. So yeah.
And in the current, like, when did you start noticing that she started exhibiting more anxious symptoms again?
I guess I would say around high school. I think, you know, she was always she is and always has been very bright, but I think high school started to get a little more difficult for her. Like she had to actually try, you know what I mean? Like I think she was cruising for a while.
Do you think throughout the entire high school period she's been like this, or it started to get worse like
I would say
6
around
months ago, a year ago?
I would say, you know, it's obviously been really bad for the last 2 weeks because she hasn't been in school, but you know,
So that's what really brought you in here.
Yeah, I think this is the worst it's been.
Okay.
But I would say it got a lot worse. You know, she's always been anxious, like I said, but it's gotten a lot worse, I think, since she was a sophomore. So I'd say from like sophomore year to now. And then us having, you know, trying to get her to go back the last 2 weeks is sort of like the straw that broke the camel's back, like really pushed us to come here, realizing that it wasn't getting better, it was only getting worse.
So you mentioned, you know, that you had 2 siblings on both sides of your family who have autism. What about, can you tell me more about like your family history? Like,
sure, yeah.
What about, do you have other children?
Sure, so I guess I'll start with myself. I don't know if this is important. I mean, I have a history of hypothyroidism, and I take, actually I don't need medication for it anymore. I was treated for it, but it's subclinical right now. So I don't need to, and I don't have any symptoms. And I do have a history of anxiety myself. And that, I think kind of started, you know, when my career was taking off and just kind of like the pressures, you know, and I work in media and I just have a very intense job and you know, I'm high up and there's just a lot going on, but I feel like the medication that I take Alexa 40 milligrams a day and Ativan, half a milligram, you know, 3 times a day as needed. I don't even take that like every week, but usually just when like things are getting a little crazy. But her dad is ADHD, and he was diagnosed when he was in grade school. And by the way, I'm 44 and he's 43, so he was diagnosed a while ago. And you know, I don't know if Jack has medication for it still. I know that he was taking Concerta for a while. With the nationwide shortage, you know, I know that he was like talking to his psychiatrist, so we'll have to talk to him and see if he's still taking it. But I know that he was on the Concerta for a while, and we kept that hidden away from the kids and made sure that they didn't have access to it. He also has high blood pressure, which we're trying to manage with diet, and it's getting a little bit better. And he's trying to lose a couple pounds. Doctor said that would be helpful. And then Alex's brother Tristan, he's you know, he's a year older. He's actually just started he's finishing up his first year in college. He's fine. You know, regular like life stuff, but no anxiety or ADHD or depression or any of that. Like he's pretty stable. Oh, and she has a younger sister, Marissa, and she's 13. And no issues with Marissa either. No mental health diagnoses either, or medical issues, I mean. And then I just wanted to tell you about her grandparents.
Yes, please do.
You know, before I forget, her her maternal grandmother is, you know, she has a history of anxiety since like her 20s. Kidney cancer at 59, she overcame it. She's in remission. And her grandfather's 69, he doesn't have any issues. They're both retired. And so yeah, my mom has anxiety. And then on my husband's side, grandpa's 71 and grandma's 70, but they don't have any mental health or medical problems. I mean, they can run laps around us somehow. I don't know how they don't have anything, but it's amazing. So yeah, that's just kind of a rundown of like her family history.
Have anyone in your family have ever attempted suicide?
No, not on either side.
Okay.
No, I don't know anybody in my family that's had like severe depression. You know, I think the one cousin on her dad's side with autism was having some depressive symptoms, but they got him involved in like more activities and group, sort of like group activities with other people who also have autism, and I think he kind of needed that sense of community, and he's kind of involved with that now, and seems to be doing a lot better since we've seen him for the holidays, the previous holidays, yeah.
And how would you describe your family, your relationship with your husband, your children?
Sure. So, you know, me and my husband, we've been together for, oh boy, like 20 something years now, and met in college, and we, you know, we've had our ups and downs, but we're really strong. We actually had to do couples counseling ourselves due to some infidelity on his end. But that was about 5-6 years ago, and we've been really good ever since. And, you know, I think that married, sorry, that's me. I'm thinking of Alex, and I'm talking about myself. Alex has always had a good relationship with her older brother. I think he really looks out for her, and, you know, I know it can be weird, it can be tough at that age, because when they're close in age, you never know if they're going to be getting along or not, but they've always been pretty close. You know, he's definitely more outgoing, and he doesn't have any anxiety, and so I think he's like a protective older brother, and you know, but he's away in college now, and I think, you know, now that I think about it, like when he left, she started to feel a lot more anxious too. And then her younger sister, Marissa's 13, but she's still in the middle school, so they don't really like cross paths. They get along, but you know, they get their tiffs. They have their tiffs here and there, but you know, Alex has just been so kind of isolated with these anxiety, these panic attacks. I don't even know what they're called. That you know, Cassandra's kind of just doing her own thing with her friends lately, and she really tries to be there for her older sis too, but I don't think she knows exactly what to say or do. And you know, I mean, what 13-year-old isn't going to know exactly what to say for their older sister?
Yeah. Okay.
But overall, I'd say, you know, we're, you know, pretty supportive family, and we make mistakes, but I think, you know, Alex will speak to you privately, but I, you know, haven't seen any major issues with the siblings or with us or anything like that, or acting out.
Okay.
Yeah.
And well, I know you said that you know, Alex, they, you know, exhibit some delays when they were smaller, but they pretty much caught up they didn't need any early intervention program or anything like that. But tell me, what about the lead, the water supply, how was that?
You know, we lived in Flint, Michigan, actually.
Oh, okay.
For you know, just a couple years, and we relocated to the Northeast, you know, a long time ago. But we were there for a little bit because my husband had some job stuff going on there, and we did check for lead. It was a little bit elevated when she was around 2 or 3, but we, like, you know, we really left soon after because all that stuff came out in the news in that area of the lead issues. So, you know, she hasn't been checked since because we moved, but yeah, I'm not sure because that was
No, thank you
quite a
for
long time
letting me
ago.
know. Yes.
Yeah.
Thank you for
Otherwise, I don't think anything else, you know, from that time.
Okay. Alright. And let me just look through here to make sure I have all the questions I wanted to ask you before I bring Alex in, okay?
Sure, yeah.
Alright. Okay. Oh, are you guys practice any particular religion in the house?
Yeah, I mean, we're Protestant. We go to church sometimes, probably should go a little bit more, but, the kids, were raised Protestant, and, as they get older, I think they're less interested in going to church, but, they have, we have a little bit of group, a community, I guess you could say, from the church, and we see them, every couple months or so. Yeah.
Okay. Alright, Mary Beth, I think this is all the questions I have for you right now.
Okay.
Let me just talk to Alex.
Sure, yeah.
And then I'll bring both of you guys back in and tell you guys, my plan for you guys, okay? Do you have any questions for me before I run out? Anything that's concerning you that you think I should?
I just want you guys to be able to, I think she'll probably bring this up, but there was an issue with this concert that, we tried to go to a couple weeks ago, and, she had like some issues with the crowd, so I think there's just some component to this anxiety that relates to being in crowds, and it's, also compounded with the pandemic. I think things are better now, but when she's in crowds, she kind of gets freaked out about like germs and getting sick, so that's another thing. So I think she'll probably bring it up, and she's not one to like kind of hold something like that in, but just in case she, doesn't, maybe that's something you can address with her.
Okay.
But she knows that, we were going to talk about that here. Anyways.
Okay,
Yeah.
thank you so much, Mary Beth. So let me get Alex, okay?
Great.
So you can wait in the
Thank you.
waiting room and I'll call you back, okay?
Okay.
Hi, Alex.
Hi.
Hi, Alex. My name is Alicia. I'm Alicia, Dr. Roberts.
Cool.
But you can call me Alicia if that feels better for you. How are you today?
Okay, hi Alicia. I'm okay. My name's Alex. Yeah, so I know you just talked to my mom.
Yeah.
And
So what's up, Mama's? She told me that she's concerned. You've been a little bit more anxious. You have been missing school.
Yeah.
Can you tell me? Would you like to tell me what's going on? And I just want to let you know, Alex, that everything that you discussed with me, it's basically, confidential. I'm not going to share it unless there is something that tells me that you're at risk for hurting yourself or others.
Okay.
Then I'm afraid that I have to, share that. I cannot keep that confidential because it's for your own protection. Okay.
Okay. My mom, she knows a lot about everything, but there's something she doesn't know about. So thank you. I just, that's part of the reason why I'm a little scared right now. Is just because I just hate coming to doctor's offices, and we had to take the subway to get here because the Uber was late, and there was just like crazy crowd in the subway, and I just felt really anxious and like hot, and oh god, my like I felt like my heart was beating out of my chest a little bit, and it's just like I don't understand. I feel like I look around and nobody else has this feeling afterwards, and it feels like I'm out of control of my body sometimes, and like sometimes I get like I feel like I can't breathe. And one time I told my doctor, and he said my lungs were fine, and then I told him that my like what I just said about like my heart beating really quickly and like pounding, and he did I forget what it's called, but like when you put the stickers on the chest and then it's hooked up to the machine.
Yeah. The EKG?
The EKG, yeah. He said he said there was nothing wrong with my heart, so I just don't really understand what's going on, and it's happened a couple times now, and it's just really scary, and I'm so tired of feeling like this.
I'm so sorry that you have been feeling this way, Alex. Is that the reason why your mom mentioned to me about a concert and that you have been missing school? You haven't been in school for 2 weeks. Can you tell me a little bit more?
Yeah, so my mom was getting me like my birthday's next month, and
Happy birthday.
thank you. So my mom was giving me like an early birthday present last month because Ed Sheeran was at Madison Square Garden, and I just love him so much. And you know, I was so excited. I know all of his songs, and I was like, me and my little sister were on YouTube like leading up to the week before and like watching everything. And you know, when we got to the security line, it was kind of like the same symptoms that I felt today on the way over here, like those, just like the heart like beating at like almost in my throat, and I just felt like a choking sensation, and I couldn't breathe, and I was sweating a lot, and I just felt like stuck, like, you know when you're in a dream and you just feel like stuck. I just felt like I couldn't, like, I was like frozen. My mom was trying to like convince me to go in because she knew that I really wanted to see him, and she was like, you know, this is gonna be so much fun, but there were just way too many people, and I was just getting pushed around, and bags were hitting me and people, and the security guys were kind of mean, and I'm just a little scared, you know. I know that like the pandemic's like over. I don't even know what that means, but and I have like I have all my COVID shots because my mom took me to the doctor, but like, you know, there's so many like diseases out there, and I'm just really worried that I'm gonna get something being in the crowd, and you know that kind of also freaks me out. Like, it's not just the crowd, it's just, I don't know, I can't explain it, but I was really sad that I couldn't go, and we went back to the hotel after and just like watched TV, and then I fell asleep.
So when you're in that moment, right, when you start feeling that particular way, you know, your heart is pounding, you feel like you can't breathe, what tends to make you feel better?
I mean, usually I try to remember, like, I have a counselor that I started seeing. Her name's Jean. I'm in counseling in Cicero, New York. And she kind of like helps me. She tells me that I need to breathe more slowly and make my exhales really longer than my inhales, and that, you know, reminding myself that it's temporary. Like, she told me there's a word, oh, it's called like a mantra, like I need to just like repeat a mantra, sorry, and you know, it'll pass, and just breathing slowly, and knowing that like it's temporary, I guess, and it usually goes away. But I mean, it always goes away because I'm not always like that, but it just feels annoying and frustrating and scary that it comes on. So it's just so crazy, like how bad it gets.
So
I feel like I'm gonna die.
Oh, I'm so sorry, Alex. So how long has this been like happening with you? How long have you been having these symptoms?
I mean, the panic attacks, I guess, like over the last, the last year or so, I haven't really wanted to go to school, and that, I think, is when they started, is in the morning. Like, I just, like, I don't know what I'm gonna do with my life, and I'm scared because I'm a senior, and I'm supposed to have everything figured out, and I got accepted into a couple colleges, but they won't take me unless I keep going to school, and I might not graduate, and I don't know, I guess I'm anxious about everything, you know, next steps, and just doing well in school before I graduate. And I keep, you know, having these mornings where I can't go, and now it's been 2 weeks. And so I guess to answer your question, it kind of started in the beginning of this year or last year.
So you have the symptoms in class as well?
I mean, if I can go to school, sometimes I've had to leave class. And one time I had a panic attack in the bathroom, and somebody heard and asked if I was okay, and it was really embarrassing.
Okay. All right. Thank you for sharing that with me. I'm so sorry. I'm gonna ask you a few other questions again. When last do you have a primary care provider that you see?
Yeah.
What's your doctor's name?
Dr. Martin.
And how were your periods? Do you have your period? When was it? What age you had your first period?
I think I was, they started when I was like 12, but I'm on the birth control pill. I'm not, like, I know you're gonna ask me, I have never had sex. I've only like kissed like 2 boys in my life, and one of them was a dare. So, but I'm on the birth control pill, I think it's called. I don't know the name of it, but it has iron in it, I guess. I was having irregular periods when I was 15, so they wanted to do that so that I could have period every month.
Okay, so you're on it to help regulate your period.
Mm-hmm.
And how are your periods?
They're lighter now. Like, they were a little bit heavy before, they're lighter now. I mean, not super heavy or anything, but I guess, just like a couple days during the 4th week of the pills, I have like bleeding for like 4 days.
Okay. Do you have any allergies to any medications or fruits that you know of?
I'm lactose intolerant, but no medication allergies as far as I know.
Okay. Alright, so I'm just gonna ask you.
But you should ask my mom in case.
Yes. Your mom will know. I did tell her if there's anything I need to ask. I will ask her. So yes, that's something I'll definitely have
Just
to
in
ask
case,
her,
because I don't think I'm allergic to anything else, but I can't remember because I was like a baby.
Yeah.
Yeah.
Okay. Quick question. How is your eyes? Do you have any problem with your eyes, blurry vision, anything like
I have
that?
contacts
You wear
because
contacts.
I can't see the board at school otherwise. But I can read fine. It's just I can't see distance very well.
Okay.
But I had vision. I went to the eye doctor like 4 months ago.
4 months ago, and everything was good.
Mhm.
Your prescription for your contacts is fine.
Mhm.
Okay, awesome. Any heart problems? Any respiratory, like lung problems with your lungs?
Only feeling like though, like when I said, with the Ed Sheeran concert and when I was coming here, and then sometimes in the mornings that shortness of breath and the heart palpitations and feeling like I want to faint sometimes.
Oh, you feel like you want to faint?
Yeah, and I also forgot to mention I felt like out of my body at Madison Square Garden. Like it was, like I could see myself having the panic attack. I guess that's what it's called. That's what Jane called it, my counselor.
Out of body?
Well, she called it a panic attack. I don't know if that's like,
Okay.
yeah.
Okay. But when you saw, you had mentioned to me, or was it your mom? They said that they did. You said they did an EKG.
Oh,
it was fine. And you checked your lungs. Your lungs
Dr.
was
Martin
fine.
said nothing was wrong with me. Like, and yeah.
That's really frustrating that you're feeling these symptoms and you're hearing nothing is wrong with you. I totally understand how you feel, and I'm so sorry that you feel that way. All right,
Thanks.
I'm gonna ask you a question again. What about any problems with your bowel movements, going to the bathroom, urinate,
Yeah, sometimes.
peeing, pooping? Any problems?
Well, sometimes I get constipated.
Okay, you have constipation.
And Mom makes me smoothies with like green smoothies, and they actually taste pretty good. But I get really constipated, and my doctor thinks it might be related to the anxiety, but he said it wasn't anything like I was eating wrong, or he said it wasn't like a problem in my stomach, I guess, or anything. But I guess I know he said I was supposed to poop every day, but I don't.
Okay. So besides the smoothies, are you taking anything else or no?
Mm-mm.
Okay. And you said that you were taking the
Oh yeah, I'm
pills?
still taking the birth control pills.
Right.
But sometimes I take a multivitamin, like when I remember, they're the gummies. But I mean, I guess like I take them most days. But that's it.
Okay, when you remember, okay. I hope you're taking the birth control.
Oh yeah,
Okay.
I do, cause actually I have like a calendar in my room that my mom created for me, and so I have a little alarm and then I check it off on my calendar.
Sounds like you and your mom is very supportive.
Yeah, I get along really well with my mom and my dad, but my mom knows a little bit more about stuff. Yeah.
So you think your relationship with your mom, your parents, how is your relationship with your family?
It's good. I mean, sometimes I just feel like, I guess weird, because I feel like I'm the only one that's like having these like weird like feelings, like when my heart's beating really quick. Like my older brother Tristan, he's in college and like he's like studying architecture and he doesn't ever seem stressed out about anything. And my little sis, Marissa, she's 13, she's in middle school and she's a really good soccer player and like, you know, she gets like B's, A's and B's and like she just comes home and is just like able to relax and she doesn't have any problem going to school. And it's like I want to be the big sister that shows her how to like be confident, and I feel like it's the other way around, you know.
It
So
must be very frustrating.
yeah,
So
but they're good. They're there for me. Like sometimes when I feel like I can't breathe, my brother, when he's home, he'll help calm me down, and sometimes my sister too. And our schedules are kind of like opposite right now. And you know, my dad is he's he's great too. I mean, he gets like mad sometimes about things, but not like just like normal dad, I guess. You know, like nothing crazy. Like I never had any issues with my parents, and I mean, Jean. I don't know if this is like weird to say, but Jean asked me if my parents ever like abused me or anything, and no, I've never been like, you know, physically abused or verbally abused or anything like that. But
I know your mom has a very busy schedule because you know with her
mom has a
career.
really important job. Yeah.
But you think that she's around to support you? Do you think that's what makes you anxious? Mom not being around and possibly your brother leaving to go to college?
You know, I feel like my mom was like not around as much when I was growing up because she was so busy and she works like 80 hours a week. But now she's like so high up that she can like take a little more time off. But sometimes I do wish like, you know, we could eat dinner together every night, and you know, she's not always there in the morning when I'm having like these
anxious feelings.
Yeah, the anxious feelings. Like my dad's there, and sometimes I just feel like my mom's a little more helpful for calming me down. Okay. Not that my dad's bad, just that, you know, sometimes it's easier to talk to moms about feelings.
What about your, like, have you ever injured your body, like get any broken any bones or anything like that? Any skin problems?
I had a lot of eczema when I was younger, and they figured out I was lactose. Oh, and I used to get really bad diarrhea, but they realized it was from the lactose. And then I did have what's it called when they take out your tonsils? Because I used to get a lot of strep throat infections. So I got a tonsillectomy. And that was when I was 14. And then, but it wasn't that bad because I got to eat a lot of Jello and pudding. And then
you like Jello and pudding?
And then
I'm trying not to laugh at the patient.
And I've never had a broken bone, but I did have stitches in my finger because I cut myself accidentally when I was playing on jungle gym when I was 10.
Something I have to ask your mom, if you were ever hospitalized as a kid, besides in the NICU, like any childhood sick illnesses, but maybe when she comes back in. But did she ever told you anything when you were a child?
Oh yeah, I had pneumonia when I was 7, and I had to go to the hospital because I used to have asthma. I don't anymore, but I had childhood. I guess they call it childhood asthma, and I grew out of it. But the pneumonia was so bad that it made my asthma bad, and I had to go to the hospital, and they had to give me that machine with the medication. And I only stayed for like 4 days or 5.
Oh wow.
But
okay, so you were hospitalized.
yeah.
Okay. All right. Okay. I will confirm with your mom just to make sure. All right.
Yeah, I was really young though.
Okay. All right. So I think blood work. Do you remember when last you had blood work done? Did your primary care doctor said that everything was okay?
He kind of wanted to do some blood work a few months ago, but I said no because I really, really hate needles. And my mom was trying to get me to do it too, but I couldn't do it.
You're afraid of.
I mean, I used to get it fine. Blood work, like, I remember I did a blood work appointment, like, when I was maybe like a freshman in high school, but then over the last few years, I just got really scared of needles for some reason. Yeah, but I never fainted or anything, but like I feel lightheaded sometimes, and that feeling with like the heart palpitations happens again.
So Alex, how is your sleep patterns?
Sometimes it's not so good. Like I'll wake up a lot because I'm worried about going to school the next day. So I can't really sleep throughout. Like I wake up a lot, and I used to sleep really well, and I sleep really well on the weekends, but during the week it's hard.
It's harder. Okay.
Like maybe 3 or 4 times a night I'll wake up, and sometimes I can fall back asleep, and sometimes I can't. And then usually I fall asleep right away.
And how is your appetite?
It's not so good. Like I feel like I'm just not really hungry lately.
Not hungry lately, okay.
Yeah, like I'll probably like pick at like after school snacks, but I'm not like hungry during the day.
All right, and have you ever been hospitalized for any psychiatric, like mental health issues? Have you ever tried to commit suicide?
No.
How are you feeling right now? Do you feel like you want to hurt yourself or hurt others?
No.
Do you have thoughts?
No.
Do you hear anything telling you to?
No.
Okay. All right. No psychiatric. Okay. This one, like I said, whatever you tell me here, it's just between both of us. I'm not gonna disclose it to your mother or your parents unless it's a danger to yourself. What about illicit drugs like any marijuana, smoking, heroin, anything like that?
One time, like I had a few sips of like peach schnapps at sleepover. That was like 6 months ago, but otherwise that was the only time, and it was kind of gross. I didn't like it. It was too sweet, like medicine. But I didn't know. One time, like I asked my mom if I could have a sip of her wine, and she said yes. But that's because we were in Europe and we were with family, and they said it was okay to try a little sip. But no, I don't really like the taste of alcohol, and that's also why I'm nervous about college. I'm nervous about drinking, and I've never smoked cigarettes, and I'm scared of weed too, because somebody at my school got arrested for selling weed, and I don't want to go near that because I already have enough problems trying to graduate, you know.
What about your interests? What interests you like? I know you mentioned that you're very anxious. You feel very anxious. You have these feelings. Your therapist said it was a panic attack that you were possibly having.
Mm.
But do you have any hobbies that you like? Have you been doing anything that you like lately?
Well, yeah. I like to draw, and I like charcoal as well, and sometimes I like to do oil painting. So I guess I like anything related to like art. Um, and I used to go horseback riding as well. I only stopped because of like school and stuff like that. But and then I also like to ride my bike in my neighborhood.
And I know you said to me that you know your parents never abuse you. Um, but has anyone, a close family member, anyone has ever did you anything that you didn't consent to or liked or you felt a kind of way that you never told your parents about?
Well, there was like this. It wasn't a relative, but it was actually like so. When I was a freshman in college, I mean high school. Sorry, I keep thinking about college.
Like Alex, why?
Yeah.
Why you get it?
Why am I growing up so quickly? So, yeah, I was playing soccer, and that was the only year I was on the soccer team, and there was this like assistant coach, and he was kind of young, and we all thought he was really cute, and his name was John, and we like all the girls had a crush on him, but then one day like he came up to me and he like asked me out, and then he touched my butt, and it felt really weird because he's like, I don't even know how old he is, but he's an adult, like maybe 30, and I felt really weird after that, and then I didn't want to play anymore.
Did you tell your parents about it?
No, I didn't tell anybody. I didn't even tell Jean, because honestly I didn't even think about it until just now.
I'm very sorry. So you are aware that if someone touches you without your consent, it's not the right thing, and you were a young child.
Mm-hmm.
You were. I'm so sorry.
You're a teenager.
You were a teenager.
Still am.
You were a younger teenager, and is the coach still working at the school?
No, I think he left like that year, but I didn't talk to any of my teammates either because I thought maybe it was just me, and I thought maybe it was my fault because we did all say he was cute like in private, but he wasn't even there.
Yeah, I'm so sorry you have to experience that, Alex, but next in future, if anyone, touches you, you need to speak up for yourself because, it's against the law, for someone to touch a minor, and, he can be arrested and will not be able to touch anyone again, you or anyone else again.
Okay.
Without their consent, okay?
Okay.
So I'm really sorry that you had to do that, but I'll let you know that if you still, like me speaking about it, makes you feel some sort of way, we can see if you can get the proper therapy for you to help you, trauma therapy, because it is a form of trauma that we can help you deal with that, okay?
Okay.
All right? You're not the victim, okay?
Thank you.
All right. Let's see again. And you're under your mom's insurance, so I know you're fine. You have very good insurance right now.
Yeah. That's what she says at least.
So you have pretty much good memory. I asked you to say the count 7 backwards.
Yeah, and you said cat and red roof, and I remembered it
Yeah.
5 minutes later.
Yeah. So you're pretty much good. And so the question, the GAD. This is what I want. I think I may have to bring your mom in because I just asked you the questionnaire. It's cause okay, let me go over. You know what? Let me bring your mom in.
Okay.
And then I'll go over it together with you guys. Where I'm kind of leading to help you with what you're experiencing, because we want you to be able to go to school. We want you to graduate. We want you to not have this awful feeling that you're feeling. Okay, Alex?
Okay.
All right. Let me bring mom in. Mary Beth, come back in, please. Thank you. Have a seat. So, Mary Beth, Alex and I were talking, and it sounds like, listening, it sounds like it could be general anxiety disorder that she has. But before I even go into giving her treatment, she said she needs to get blood work done for me to check a couple of her labs to see her thyroid, given your history of thyroid disease.
Oh, that makes sense.
And also, I want to check it just to make sure, just to rule out that there's no thyroid problem. Nothing is wrong with her heart, just to make sure she's healthy before we start her on any medication. And normally blood work might take a couple of days to come back, but based on the questionnaire that I asked her, because her symptoms, she was mentioning like being in crowds, she was afraid of germs and stuff. I asked her a questionnaire that to rule out if it's possible, the questionnaire I asked you just now, Alex, to rule out if it's general anxiety or OCD that I possibly think about,
Okay.
And it so happened that she scored high with a general anxiety disorder based on her symptoms and based on her answering the questionnaire.
Okay.
I would like her to continue with the therapy that she's receiving. Because cognitive behavioral therapy it will help her. Like she was explaining, she learned how to breathe and learned how to.
Yeah, she was doing that a lot, especially at home with her brother, from what she had learned. So I think that was good.
Right. So she will learn other strategies, and she'll have somebody to talk to. And I think she mentioned she really liked talking to the person that she is currently seeing.
Yeah, she loves Jane.
Yeah. So I want to continue that, and if her labs come back normal, I would like to start her on a medication. It's an SSRI. I am thinking about she is 17 going to be 18, so she's going to be adult soon. So I can start her on, I will normally start at 5 for younger, but I may start her at 10. Lexapro 10, and it normally takes 4 to 6 weeks to actually see some improvement.
Okay. Yeah. Is that like Celexa, like the one I take, or is that like similar?
Yeah.
Okay. Yeah. All right. I mean, I've never been on it, but if it's the same, hopefully it'll be helpful for her because it's been really helpful. Celexa's been, life changing for me as far as anxiety.
Yeah.
What do you think about that, sweetie? I mean, I don't know if I want to start. I'm just kidding. Okay, now Alex. I don't know how I feel about medication. I guess I'm a little nervous, but I just want to feel better, and if that's what's gonna help me feel better, then I guess I'm open to trying it. And I don't know.
So I know it's scary, Alex, but I'm not the type of provider who normally just starts medication right away, but this has been happening a long time, and now
Yeah.
it's really affecting the way how you are functioning in your daily life, and when it comes to that point, then, and especially if you're already receiving therapy, then the next step is to try medication therapy. So let's try it. All
Okay.
right, I'm doing a very low dose
Okay.
of the medication, and we will see. I'll bring you back in 2 weeks just to see if there's any symptoms. Now, I have to tell you guys that when I do start this medication, there's something called a black box warning. Black box is just saying that, the warning is just that you have a high chance of suicidal thoughts in teenagers and young adults. So I just want to, let you guys know that if you start feeling like you want to hurt yourself, please let me know. Also, the medication tends to affect so you did tell me you're lactose intolerant, but if you start getting like certain like gastrointestinal symptoms while you're taking the medication, it might just be it's the medication, because it also causes like symptoms that affect you.
So I should just tell you if that happens, or
Yeah, like if you start feeling like after you start taking the medication, any symptoms
like I'm gonna throw up, or okay,
throw up,
all right,
nausea, stuff like that.
Mom,
And you want to take the medication around the same time, every day,
okay.
But when we reach there, we'll continue.
Okay. I'm flipping back to Mom now. Yeah, honey, I think, that might be a good idea to try this medication and give it a shot, and continue to see Jean and work on those, strategies like Dr. Alicia was talking about. And, we can keep you on track with the medication and have you take it at the same time as birth control. Can she take it at the same time as her birth control pill, or?
Yeah.
Okay, so you can take that at the same time as your pill, so it's easier for you.
So I think so I know you were mentioning that you're a little nervous about taking the blood. How do you feel like if you're laying down on the bed and you're not looking when the needle is going in? Maybe you can try something.
I guess if I close my eyes and there's like, can you play like music or something? I just need a distraction.
Yeah, we can
It does.
Do you have your iPod? Yeah. AirPods?
Yeah. Yeah, I have my Bluetooth headphones.
Yeah. Yeah, you can play your music and then look away. It tends to help, because this will really let me know, guide the treatment that I want to do for you. Before you leave though, Mom, very important, I wanted to know, I felt so so much compassion for your daughter that I forget to ask you about like any childhood illnesses that she may have.
Oh, you know what? She was. I should have mentioned that she was in the hospital. I think you were 6 or 7, and she had asthma as a kid, and it was well managed with like a albuterol, I think it was called. But she got pneumonia, and I think it just made her symptoms a lot worse. She had some major trouble breathing and like really gasping for air, so we actually had to call 911, and she was in the hospital down the road for about I want to say 4 or 5 days, about 4 or 5 days. They put her on antibiotics and gave her like some treatments for her breathing, and she was much better after that. And that was the only time I can think of, besides she was preemie, that she was hospitalized.
Okay. No head injuries, no Infections besides the pneumonia, no kidney problems.
Just the
disease,
normal
nothing
stuff.
like
Yeah,
that?
she used to get a lot of strep, but you know, we didn't. Oh, I forgot to tell you also, she got that tonsillectomy when she was
Right.
in her 11 or 12, and yeah, beyond that, no.
Okay. And the medication she's taking is just the blood control and her vitamins.
She doesn't take the vitamin every day, right?
Right. Yeah, you know, teenagers. Yeah. I'm sorry. I'm not. You know, Alex. I know you do your best. You have a lot on your plate. You know. I know. I was there, and it's challenging taking any medication at all, right? Okay. So guys, it was nice meeting you. Alex, let's go take your blood. Mom, I will call both of you guys back in about 2 days, and then we go from here. Okay?
Okay.
Do you have any questions for me before you go?
I guess we'll see in a couple weeks, and if we have any questions about the medication or side effects, should we just call the office or?
Yeah,
Okay.
you can call the office. One of the nurses will pick up. And
Okay.
if it's really important, they're gonna call me. And
Go from there. Okay, I think that's it. Alex, no, I think that's everything. Thanks, Dr. Alicia.
Yeah. Oh, and why I'm doing the blood is like I mentioned. You were mom, Mary Beth. I know you had the thyroid problem, so that's why I just wanted to just kind of do it to make sure that she doesn't have thyroid problems.
Oh yeah, I never thought about that. That makes sense.
Yeah, just I don't know if I mentioned to you, like why are you taking my daughter's blood, so let you know.
Thank you.
All right, Alex, nice meeting you, and we will get you. We'll get you this together, okay? All right.
Okay,
Bye.
thanks, Dr. Alicia.